Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hello and welcome to Research Perch. I'm Doug Nelson, the president of the Massage Therapy Foundation. And today I'm pleased to welcome two guests from the Massage Therapy Program at Nationwide Children's Hospital in Columbus, Ohio, Corrie Frey and Deborah Zerkle. Good morning and welcome.
Good morning.
The Massage Therapy Foundation has an ongoing relationship with Nationwide. They were a 2017 research grantee for their study on decreasing opioid use in pediatric patients, and Corrie was a poster presenter at the Massage Therapy Foundation's International Massage Therapy Research Conference this past May. So welcome, Corrie and Deborah. And if you would, can you introduce yourself, Corrie? Can we start with you?
Absolutely. My name is Corrie Frey. I have been working at Children's Hospital here in Columbus for 19 years. I've been doing massage therapy for the last 13. I primarily have worked in oncology for the past 7 years, but at some point over the 13 years of being in massage, I've worked on every unit at some point or another. So I originally started out in nursing school, but just kind of wasn't as passionate about it as I thought it would be, but knew I still wanted to do something hands-on with patients. And I already worked here in another capacity, and so I just kind of like fell into massage and very passionate about it from day one.
Wow, what a story. Gosh, Deborah, how about you?
I am Deborah Zerkle. So I've been here at Children's for 7 years, massage therapist for 13. All of us have definitely been on every unit. The unit that I call home right now is the gastrointestinal unit. Also, I work with patients that have had trauma, the orthopedic patients, and our colorectal malformation patients. And the reason I got into massage therapy was when I was a teenager, I was not very graceful, and I ended up needing something to help me with pain after some falls, and massage therapy was what helped me the most. Wow. So later on, then I decided to go to massage therapy school myself, so I could offer that.
So often that people who get into this field have some personal experience that way that prompts them and directs them. So, yes. Or you know, in another way, like Corrie, just finding their passion through the work. So, yes. Awesome. Well, we've really planned a two-part discussion today with our guests. We're going to dive into the work that Corrie and Deb have been doing at Nationwide and discuss how a hospital-based program works and how this program got started. And then in part two, we'll move on to discuss, you know, kind of the logistics of the program and how people who are massage therapists now might be interested in joining or starting or working with a similar program in a hospital near them. So, super. Well, let's begin in part one. I'm going to switch to the slides here, so pardon me for 1 second. Tell me a little bit about the program history, if you would.
So our program originally began with a grant that was provided to a massage therapist who was actually already working here as a social worker in that capacity. Her name was Sue. Her grant was to work with patients with cystic fibrosis. And through that grant, there was a doctor that kind of got on board, and she challenged Sue, basically, I have this patient that we need to extubate. This patient was intubated, meaning they had a tube down their throat for breathing. And she said, if you can massage this patient and relax them to the point where we can have a successful extubation, then I'm on board. And so Sue was able to do that. And from that point, that physician became a physician champion for the program and kind of helped get it boosted to not just being grant funded anymore, but actually being adopted through the hospital. So Sue was pretty hardworking on getting our program advanced. It started out very slow, but by working here in the social work capacity and then as massage therapist capacity, she made connections and even at times would tell us how she cornered hospital administrators in an elevator to let them know massage therapy was here and keep getting our program moving forward. So in 2003, the massage therapy program then moved under the umbrella of clinical therapies, which encompasses massage therapy, therapeutic recreation, physical therapy, occupational therapy, and speech therapy. So now we are now fully a part of that group. And back in 2003, when this all began, we were actually part of the room charge, but now we've advanced to the point where we are actually billing insurance for massage therapy. Wow. So it's taken a while, and I remember back when I started that there were some older physicians in the hospital that still refer to massage therapy as fluff, and so they wouldn't necessarily order it for their patients because they didn't see the need or the purpose of it. Like, they were all medical, let's get them in, do their thing, get them out. So now we've gotten to the point where the physicians respect us to the point of coming into rooms and noticing that a patient is getting a massage, and they will back out and say, I'll come back later when your massage is over. So we've made huge strides in the last 18 years.
You know, two things strike me. One, the time period. I mean, this was, what a foundation. And, you know, in 2001, 2003, wow, you guys were really leading the field, which is amazing. And the second thing is just that anything like this, it never starts easily, right? It always starts with a difficult challenge and with a ton of work, and laying a really deep foundation before this can ever.
Definitely.
Wow.
Yeah.
Wonderful.
Yeah.
Good work. My goodness. All right. So tell us about kind of where it is now.
So as of now, we've grown from one therapist in 2001 to now having a full staff of 14. So a lot of us may work part-time 2 or 3 or 4 days a week, but we do have a few that work 5 days a week. We're here Monday through Friday. Right now we do have 1 contingent staff, but we're hoping to increase that as well. So the really cool thing is that all of our therapists are hired through the hospital. We're not contracted. So we are benefits eligible employees. We get paid time off, 401k, health insurance, all that, which is a very nice benefit. And one thing that I was going to say is, out of our 14 staff, 9 of them have either worked here in a prior capacity or have gone through our student internship program, which I'll go over next.
Wow. Wow, amazing. And so tell us about the internship program.
So for our student internship program, we are connected with our local community college, which is Columbus State, and it's chosen as an elective, and all the students have gone through the massage therapy program, so they are ready to either sit for their Ohio licensure exam, or they've already been, recently licensed. So they shadow us for 12 weeks at a time, and they go through most every unit at some point or another, and they're responsible for taking notes and providing a report at the end on what they've learned. So it's kind of been a really cool thing for us to see, things that we take for granted, to then see a student at the end share their experience and things that we've kind of forgotten or, have taken for granted on a daily basis. Our students remind us of that, which is really cool.
It is. It's such a benefit to have someone with new eyes looking at something that you guys do every day and don't think about, and it is remarkable in that. But what an opportunity for these students.
Yeah.
So tell us a little bit about your staff training and expertise.
So the great thing about having a large staff is that while not every staff member is trained in each of these modalities, we know that we can cross-cover each other. So if I'm consulting on a patient that, could benefit from scar massage or from pediatric myofascial release, then I'm going to reach out to one of my teammates and say, hey, can you provide this for my patient? And we can work together. So we've all had different trainings over the years, and we continue to get that training, and it's been very, very beneficial to make our team very collaborative.
Yeah, and speaking of collaborative, tell me a little bit about how that decision is made in terms of which kind of approaches are applied. Is that a decision that comes from the therapists, or?
It is. So we are physician consulted, and while they usually will put in consult or orders to us for specific things, such as anxiety or pain, it is up to the therapist's professional judgment to go in and assess that patient and evaluate them and find out what the best treatment option is going to be for them and what we can provide.
Yeah. So it seems a very collaborative approach.
Yeah.
Process as well. And these are some of the modalities that you're using as well?
Yes, they are.
Oh,
so I will say that deep tissue is a very rare thing that we would offer in the hospital. Most everything that we do is very, very light, which that was one of my biggest learning curves when I started here, because when I was in massage therapy school, everything was like, get in there, get in deep, and, you know, get those knots out. But as I've grown as a therapist, I've learned that less is so much more, and the amount of comfort that we can provide even with just passive touch and containment holds, it's so beneficial for our patients and safe. That's, we always, every day, we do no harm. We want to be safe above everything else.
Yeah. And it's really an art form in a way, I'm sure, to decide for each patient what is the most appropriate approach to use. And that's where the science and the art tend to blend.
Yeah. And it's amazing because it can change from day to day depending on like what state that patient is in that day. And yeah, therapy sessions might look completely different from a Monday to a Wednesday, depending, we meet them really where they're at.
Yeah, which is great. I mean, it's a dynamic and vibrant situation, not only for the therapist, but for the patient as well. It seems like it's not a one-size-fits-all approach.
Right, exactly.
Yeah, I'm sure there are many surprises.
There are,
Absolutely.
definitely.
Yeah. All right, so let's talk about these clinical competencies.
So in addition to some of these extra trainings that our staff has outside of the hospital, there are things within our own department that we are required to do. So in order to go to a specific unit, such as a burn unit or an oncology unit or a cardiac intensive care unit, we do have program-specific competencies that staff are required to complete. That does also include some research articles involved with it and making sure they're competent to safely provide care on that unit. We also offer a simulation lab here at the hospital because obviously in massage therapy school, you don't really get the opportunity to work around medical equipment, which can be very, very scary first time. So the simulation lab gives you the opportunity to go kind of work around that equipment, be comfortable with it before you're in with a patient for the first time and they're hooked up to multiple devices. So in addition to that, we do evidence-based practice here, which Deb is going to go into a little bit more on the next perch. We do have annual online learning modules that are required every year when our review is up, which goes over hospital expectations, hospital policies, our mission statement for the hospital. It goes over looking for abuse in children, all kinds of things. So it covers like 20 or 25 different modules to make sure that you are completely up to date on what the hospital's expectations are and what to watch for. We also do have continuing education support, which is fantastic and another benefit of being a benefits eligible employee. So we do have allotted money each year to go and seek out whatever training that we are interested in that we can bring back and use here at the hospital. And then finally, we are all healthcare provider CPR certified and every 2 years.
Oh.
So.
Wow. What a tremendous, again, what a tremendous asset for all the staff to have access to this kind of, it's not only professional growth, but really personal growth and broadening and deepening their practice and their understanding. So.
Yeah, I feel like I learn something new every day, and I've been here 7 years.
Mm-hmm.
So
definitely.
Wow. I can't help but think for people in the field, that's one of the criteria for longevity in the field, is to feel that you're growing every day. Yes. And, you know, I'm remembering a study with, this was for the mental health field, but when they asked them kind of what keeps you in the field, I think 96% of them said that the feeling that they're growing every day, you know, and that's important. And I think what's true for other fields, I'm sure is true for us as well.
Yeah, definitely.
Wow, absolutely wonderful. And you're seeing a lot of people.
We do. So if this gives you a basic idea, this was our numbers in 2018 roughly. So it gets pretty busy some days here and trying to balance out these different caseloads. So we do our best to see as many patients as we can, but as massage therapists, we are really focused on quality over quantity.
Mm-hmm.
So making sure that the patients that we are there with, that we are present and, you know, giving them the best massage and not focus so much on trying to get as many kids seen in a day as possible.
Yeah. Well, you know, I look at the numbers, but think about the effect that you're having on these people's lives,
Yeah.
and what it has for these children, what it means for these families.
Mm-hmm.
And on behalf of the whole profession, I mean, we want to thank you for representing the field so well. I mean, for the other people who are your peers in healthcare, how they perceive massage therapy now is quite different than I'm sure it used to be. And
Yes.
for these children, for these families, what an impact you're having, not just on these families, but also on the field.
It's very humbling and an honor, because we don't take for granted that we're not the norm.
Yeah, wow. You know, but for these families, now it is the norm, right? In a way,
Yeah.
right? It's like, oh, this is what happens when your child is in the hospital and they get this wonderful care. I like that norm.
Yeah, I love it. It is awesome when we have patients that come back, they're discharged, they come back, and the first thing they do is consult massage therapy. Like, they ask for it. So it's pretty awesome.
Wow.
Mm-hmm.
Wow. What a privilege. Amazing. And again, the fact that it is so integrated now into the system just speaks volumes.
Definitely. So as I said earlier, we are under the umbrella of clinical therapies, which encompasses all of OT, PT, rec therapy, speech, and massage. So the great thing is our inpatient office holds all of these people. So when we are often seeing the same patients as OT and PT, we can collaborate with them. We look at goals together. We look at the best approach for patient care. And so sometimes that might mean a co-treat with one of them, which has been fantastic. I had a patient last week that I had not been able to really get to her back because she was bedridden. So I went in with another therapist who their goal was to get this patient sitting up. So they completed their goal, and then I was able to go in and do my thing and work on her back, which was so beneficial. And the parents were so appreciative. So we aren't always stuck in the patient rooms either. We have the opportunities to go to the playrooms or a therapy gym or a procedure room. We can even see them sometimes in group settings. So it's been very nice that we're not confined to one specific type of massage or one specific thing that we have to follow. We're given a lot of leeway on how we work with our patients.
It seems incredibly fluid and flexible. And,
yes,
and again,
very.
That's, in the end, that's just incredibly beneficial for the patients as well.
And it's great on every unit, because I know even in the NICU, they'll have massage therapy come and work with a baby to keep them calm while they're trying to complete a hearing test that they might not be able to get the best outcome without having massage with them to help. So it's been really cool to see the different stories that have come from our different therapists. At the end of the day, a lot of us will come into the office and be like, I had a great session with this patient today. And we're really cheerleaders for each other, because we know what that feels like to have such a great session and an outcome from a patient or family.
My goodness, that is so incredible. And wow.
Awesome.
You know, what a difference that you're making in the lives of so many people. That is just incredible.
Yeah, it's awesome.
All right. Well, thank you so much for sharing that. There's a ton of stuff to explore. And so for those of you who are watching, we invite you to check into part 2 of where we explore just kind of the structure and logistics of a program like this. So thank you, both of you, for participating and sharing the great work that you're doing this morning.
Absolutely.
Thank you so much.
Yeah. And for everyone, again, we invite you to check into part 2 of this episode of Research Perch.
If you enjoyed this podcast, please consider donating to the Massage Therapy Foundation so that we can continue to bring you this and many other resources to increase your knowledge and improve your practice. Thank you.